Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The features of the base of the skull at first can appear overwhelming. We have discussed thus far the features of the basal portion of the facial skeleton, that part that extends anterior to the pterygoid hamulus. And now I'd like to consider this middle portion of the base of the skull and some features of the posterior base of the skull. For general overall orientation, we'll notice that the base of the skull has a lateral portion of it located in this region, the infratemporal fossa, bounded by the infratemporal crest, and leading to a region in this area, the temporal fossa, which we've discussed previously. In the mid portion of the cranial base, which is basically triangular in shape, will penetrate many foramina of various nerves and arteries supplying and leaving the brain. We can also see two very prominent openings, the posterior choanae, which pass into the upper respiratory region. Here we can see a bone dividing these two choanae, and that being the vomer. Bounding this region, we have the medial pterygoid plate of the sphenoid, the lateral pterygoid plate of the sphenoid bone, and between those two, the pterygoid fossa, the point for the origin of the medial pterygoid muscle. At the base of the medial pterygoid plate is an area that reminded early anatomists of a boat and is called the scaphoid fossa. The scaphoid fossa then serves as the origin for the tensor veli palatini muscle, which will rise along the lateral plate, medial plate of the pterygoid, hook over the hamulus, and pass into the soft palate. As we pass toward the midline, we can see that the occipital bone, which we have seen from above, now projects anteriorly in this region, joining the sphenoid at the spheno-occipital synchondrosis. Passing at the base of the sphenoid are two canals, the pharyngeal canals, which leave the pterygopalatine fossa, which we will examine at a later time. Also, one of the pharyngeal landmarks of this area is a midline protuberance located on the occipital bone about 1 centimeter in front of foramen magnum, and this is the pharyngeal tubercle. You can see the condyles here of the occipital bone, and at this point the pharyngeal tubercle. This is the point of attachment for the superior pharyngeal constrictor. If we look at the remaining midline structures, in the bony skull, we have a region which is referred to as foramen lacerum, or the lacerated foramen. This area is actually filled in with cartilage in the living individual and would form a canal for the internal carotid artery as it approaches the base of the brain. Lateral to the foramen lacerum area, we can see a prominent foramen, the foramen ovale, and distal and lateral to it, foramen spinosum. The foramen ovale then is going to transmit the mandibular division of the trigeminal nerve, and the foramen spinosum will transmit the middle meningeal artery. As we move into this lateral aspect of the base, we will find over in this region a prominent mandibular fossa, an articular eminence, and a groove, the petrotympanic fissure. We can see it here, the mandibular fossa again, and the petrotympanic fissure. The petrotympanic fissure, we will see later, transmits a part of the autonomic system. Broken off in this region, and this is frequently the case, is the styloid process. The styloid process has located beyond or behind its base, or at its base, the stylomastoid foramen, which transmits the seventh nerve as it passes onto the lateral aspect of the face. Two other prominent features of this region are the jugular foramen, the external opening for the internal carotid artery can be shown here. Now you remember we're referring to a carotid canal which existed in the foramen lacerum area, and this is the entrance to that canal. And then again here you can see, perhaps a little better now, the jugular foramen. These two features then are a part, or the basal skull part, of the carotid sheath, and will provide the principles, if you will, of the carotid sheath, the internal jugular, the internal jugular vein and the internal carotid. The base of the skull, as we work our way toward the foramen magnum, has behind the condyles a prominent foramen, the condylar foramen, which is transmits the condylar emissary vein, which will join the venous sinus, which we'll see as we go to the internal aspect of the skull. Basically, we've now completed the base of the skull on its external aspect, and I'd like to now consider its internal aspects. For this, the calivarium has been removed, and we're going to look into the inner aspect of the skull. It's sculptured, if you will, by the lobes of the brain, the frontal fossa with the frontal lobes, the temporal fossa for the temporal lobes, or middle fossa, and the posterior fossa, basically associated with the lobes of the cerebellum. Again, the prominent foramen magnum, and now we can see the lesser wing of the sphenoid as it approaches in this area. The occipital bone makes up this posterior fossa, contributes a portion of the slanted area here, the clivus, which is also contributed to by the midline sphenoid bone. As we progress up the clivus, we will pass into a fossa, the sella turcica, which is the location or the pocket which will house the pituitary gland. here we have a series of landmarks, the clinoid processes. These anterior clinoid processes are a part of the lesser wing of the sphenoid. The middle clinoid processes are a part of the body of the sphenoid and broken off in this region, but would have projected toward the middle clinoid processes are the posterior clinoid processes, also of the sphenoid bone. We will now consider features then of the anterior cranial fossa. In the midline can be located a keeled structure, the cristogalli. Lateral to it is a plate of the ethmoid bone, which is penetrated by many foramina and is called the cribiform plate of the ethmoid. We can see that the floor of the anterior fossa is made up basically of the frontal bone, though as we progress toward its boundary with the middle fossa, we begin to pick up a portion of the sphenoid bone. As we pass into the middle cranial fossa, that part bounded by the lesser wing of the sphenoid and a prominent bony portion of the, or petrous portion of the temporal bone, we can see that there are many foramina which are going to exit from this area. This middle fossa is probably the most interesting part for students in dentistry, for it is through this fossa that the branches of the trigeminal nerve are going to exit. The most prominent foramen of this region is the foramen ovale, for the transmission of the mandibular division of the trigeminal nerve. We saw it from the inferior aspect of the base, and again, lying posterior and on its lateral aspect, foramen spinosum, for the transmission of the middle meningeal artery. As we pass anteriorly, we can begin to see a foramen, the foramen for the transmission of the maxillary division of the trigeminal nerve, and this is the foramen rotundum. Its round nature can be seen here, and therefore the name rotundum as opposed to the ovale, which we saw earlier. Above foramen rotundum, we see an opening into the orbit. This is the superior orbital fissure. We saw this as one of the deep aspects of the orbit. It will transmit a series of cranial nerves, the third, fourth, fifth, and sixth cranial nerves. If we turn from the superior orbital fissure and look above it, we can see another canal, the optic canal, for the transmission of the optic nerve. Again, here, the superior orbital fissure can be located here, and the opening of the optic canal at this point, the anterior clinoid process here. If we return to the floor of the middle cranial fossa and this anterior aspect of the petrous portion of temporal bone, we'll see some important landmarks for the transmission of some of the autonomic supply. In this region, we have a foramen, or actually the hiatus of the facial canal. It's perhaps shown better on the opposite side of this specimen and can be shown here. This again is on the anterior aspect of the petrous portion of temporal bone. We'll notice that this foramen will sweep forward into the foramen lacerum, or the lacerated foramen, which houses the internal carotid artery as it passes to the base of the brain. This relationship is important, as we'll point out later in the tape. Now, as we pass to the posterior fossa, cranial fossa, we can see that the most prominent feature here is beside the foramen magnum, of course, is the jugular foramen in this region, and right above it one can see the opening for the internal auditory meatus. Now this meatus will transport the 7th and 8th cranial nerves as they enter the petrous portion of temporal bone to supply the ear, and in the case of the facial nerve, pass through the petrous portion of temporal bone to pass out onto the face. Another foramen which can be located in this region, or feature of this area, lateral to foramen magnum, is a foramen, and we saw this at the base of the skull, or the entrance to this canal, and that is it is going to transmit the condylar emissary vein into this region. This should not be confused with another foramen which is right next to it and can be seen here, and that is the foramen of the hypoglossal nerve, or the hypoglossal canal, which will begin here. This canal is located on the lateral aspect of the foramen magnum. There are many vascular structures which have left their imprints on the surface of the skull, on its inferior aspect. These are basically due to venous sinuses and will be discussed at another time. At this time, I'd like to discuss the sagittal aspect of the skull. The major feature of the sagittal aspect of the skull is that it allows you to see the bones which make up the nasal septum. And in this area we should realize that we not only have the perpendicular plate of the ethmoid and the vomer bone, which we see here, but an area that is large and is absent. It makes up this anterior portion of the septum, and this is the septal cartilage. If we remove the nasal septum, its bony nasal septum, and look at the lateral aspect of the nasal region, we can see three prominent conchae. The conchae are the inferior conch, middle conch, and superior conch. Beneath each is located the meatus of each, and it is named accordingly: the inferior meatus, the middle meatus, and the superior meatus. Into these meati you will have various foramina passing, which will basically drain the various sinuses of the skull. This large one at the base of the skull, the sphenoid sinus, is located anterior to the sella turcica and will drain into just this area. Located at the base of the middle conch is a prominent foramen, the sphenopalatine foramen, for the transmission of the sphenopalatine artery, the lateral nasal nerves, and the septal and nasopalatine nerves, which pass along the septum to the opening of the incisive canal. We have seen the incisive canal from its inferior aspect, and you can see here the point at which the nasopalatine nerve would enter this incisive canal and pass to the anterior palate region. Basically, these foramina are better probed on a soft tissue specimen in which you can follow down the various foramina for yourself and visualize where they open. But in summary, the nasolacrimal duct will enter into the inferior meatus. The middle meatus is a very busy area. It receives the drainage from the frontal sinus, the anterior ethmoidal sinuses, the maxillary sinus, and then finally, as we pass up into the superior meatus, we can find foramina for the posterior ethmoidal air cells, which will enter this area, as well as an exit for the sphenoidal sinus, which will pass into this area. These are the salient features of the mid-sagittal skull.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.